just to illustrate why, how Medicare is going to be affected by health reform, if you look at how health reform is going to be financed, about half of it's going to come from cuts to existing programs. As you can see, cuts in Medicare Advantage is a big piece of that, and other cuts in our existing programs, and the other half from taxes, or new revenue enhancements, if you want to call it that. So let me talk about stories that you might want to tell about health reform and Medicare. So one big story is coverage, how people are going to obtain insurance in the new system. One big story, I think, is that we know that rural people have less access to generous insurance. And why is that? And look at this picture. The percent of uninsured, blue is good and red is not good. So you can see just visually that the percentage uninsured is pretty dramatically different as you go across the country. Again, the South jumps out as a problem area. Texas, Florida, and so on. And if you look at the uninsured by location, the uninsured is higher in rural areas than it is in urban or more rural areas. But I think the biggest story is that there's differences in employment by employers. There's more small employers in rural areas, and there's lower incomes and higher poverty. So when that gets played out, that means that access to subsidies is going to be more important, Medicaid is going to be more important, and the exchanges are going to be more important. And again, rural America is going to be more like inner city, urban than suburban, because these are the programs that are going to be more important in urban areas as well. And not all rural areas are going to be the same. Texas is going to play out differently than Massachusetts, Missouri, and Oregon, Minnesota. And so we can't tell the same story in different areas of the country as that plays out. So I think it's really important that we keep that in mind. We ran some simulations I did as part of the RUPRI program and about the impacts of health reform. So if you look at the 50 million uninsured overall before health reform, we estimated that after reform, about 93% of people would have coverage, whereas about 83% of people have coverage now. And you can see about half of the people would have coverage through the exchange, 30% through Medicaid, and 24% of these would be children. But you can see there's a slightly higher percent that would have Medicaid coverage in rural areas. This rural came out as kind of light there. Than in urban. So again, there's more reliance on public programs, and that's the main message I want you to get. A comment about payment issues in the Medicare and Medicaid. An historical statement that we need to put as a backdrop here is payment rates are lower in rural America under government programs. That's an historical fact. And we believe that that's a contributing factor to problems rural America people have in getting access to services. I think Tom will say a lot more about that at the grassroots level and from his work on MedPAC. So you know, a big issue is how big are these payment differentials, and will health reform fix these, and how will it do it? Just a couple pictures about this. This is a picture that Kaiser put together, which is really pretty dramatic. It shows, if you break out the country by Medicare payment, per capita costs, and yellow, the deeper yellow is high, and the darker blue is low. So it really tells a pretty dramatic story that in the upper, west, those payment rates are low, those costs are low, and then in the south, the payment is high. And we've struggled with this for a long time. I know MedPAC has. So what's going on there, and why is that happening? Is it utilization? Is it something about our Medicare system? Is it something about the way our doctors operate? There's the famous story about McAllen, Texas, that talks about this. You know, we know that there's great success stories in areas like Minnesota and Oregon, Wisconsin, where they, you know, pulled a lot of efficiencies in the system, and you can see that played out. So when they're an area in the blue, is that because they're doing a really good job and being very efficient? Is it because their payment rates are historically low? Unfortunately, we've built in a system where you get penalized if you do a good job. So it has some unintended consequences when you look at things like Medicare Advantage. You get a lower payment and it's based on the payment rate for Medicare. So what is not a big surprise, what has happened? Private plan payments and so on.